So let's start. Welcome to everyone, and thank you to be here all connected today. That is the 19th of June. That is the Clean Air Day. And I would say that the word connection is more important than ever today, because only by being connected and aware, we can work together to face with the climate crisis. I'm Lorenza Onorati, resident in pediatrics in the University of Padova in Italy, and I am the representative member of Italy in the Young EAP. And today I also speak on behalf of the Young EAP group, highlighting our dedication to addressing climate change, air pollution, and their impact on health. And I'm pleased to introduce 4 important experts in this field who actually have been studying the topic for years, long before terms like climate change or climate crisis became common in our media. So thank you to Dr. Károly Illy, Dr. Helena Clemens, Fliss Stevenson, and Dr. Laura Reali. And so let's start with the first presentation. So with Dr. Károly Illy from the Netherlands. I want to present him. Dr. Károly Illy is Dutch pediatrician and former president of the Dutch Paediatric Association. He is the director of the Lung Foundation in the Netherlands, where he advocates for clean air and prevention of lung diseases. Dr. Illy played a key advisory role in the public health policy during the COVID-19 pandemic and remains active in respiratory health and child health advocacy. So thank you, Dr. Illy.
You're welcome. Just one brief question. Do you see my slide?
Yes.
Good. Okay. Well, thank you very much. It's really an honor for me to be able to talk to this wonderful audience, although I can't see the other persons who are in the audience, but it is really an honor for me to be able to talk about breathing easy. Actually, the presentation I will highlight on is air pollution, child health, and effective strategies to combat air pollution. I am myself a pediatrician, and I'm also the CEO of the Dutch Lung Foundation. First, I would like to briefly explain some important figures around this subject. Adolescents in the UK, for instance, who live in areas with higher levels of air pollution during childhood are at greater risk of reporting worse health in late adolescence than their peers living in less polluted neighborhoods. Also, children who grew up in areas with bad air quality have a higher risk of developing asthma. That is scientifically proven. 1 out of 6 children in the Netherlands with asthma has developed their asthma because of air pollution. Fine particulate matter can hinder the development of children's lungs and brains, causing lasting effects later in life. Even in the womb, a child is already exposed to air pollution. There is a link between air pollution and low birth weight, which in turn is associated with the development of asthma and reduced lung function later in life. And also, there is evidence that exposure to fine particulate matter may contribute to the development of neurological disorders. This includes impaired brain development in fetuses or children. And in children, there are associations have been found between exposure to air pollution and autism, ADHD, and reduced cognitive functioning, effects on mental development, IQ, and general cognition. I must add to this that the mechanism behind the development of neurological effects due to air pollution is not yet fully understood, but it is proven. Compared to adults, children are especially vulnerable to the effects of exposure to air pollution because they breathe more air relative to their body weight. They also have smaller lungs and airways, and their lungs are still developing. In addition, children spend more time outdoors than adults and are more physically active during play and sports. This increases their minute ventilation, which means they breathe more, faster, and deeper. Consequently, they inhale more polluted air as well. And finally, children are especially vulnerable to the effects of traffic-related air pollution because they are shorter and therefore closer to the ground. Road traffic emits pollutants at low heights, and since this height is similar to that of children, they inhale more of these harmful substances than adults. I will tell you a story of Emran. Emran is 9 years old. He used to be a patient of mine. He moved from Tiel to Rotterdam, where he now lives. He has severe asthma and lives in Rotterdam, one of the most polluted areas of the Netherlands. The unhealthy air from industry, road traffic, and shipping all converges here. Emran sometimes must be hospitalized up to 3 times a month because he experiences extreme shortness of breath. The ambulance paramedics even know his address by heart. His pediatric pulmonologist sees a clear link with air quality. When there is a spike in air pollution measurements, she can predict that Emran will end up in the hospital again. Due to his asthma, Emran often cannot attend school. His illness is therefore a barrier to his development, one that will affect him for the rest of his life. Yet, he dreams of becoming a doctor so he can help children himself. For children like Emran, it is incredibly important to work towards better air quality, to prevent worsening of symptoms, and even more crucially, to stop children from developing asthma due to unhealthy air. So, how to reach better air quality? I will go through some effective strategies. First of all, which measures are effective to reduce polluting road traffic? Low emission zones have a positive impact on children's health. German research showed that children who, during pregnancy and their first year of life, lived in urban area with low emission zones are less likely to be prescribed asthma medication compared to those in urban areas without such zones. By their 5th birthday, children in low emission zones were prescribed, on average, 13% less asthma medication. Then the example of Paris. Thanks to extensive measures against car traffic, air quality in Paris has significantly improved over the past 20 years. The city eliminated 50,000 parking spaces, introduced higher fees for SUVs, expanded bike lanes, and created many car-free zones. These efforts have paid off. According to monitoring organization Air Paris, the amount of fine particulate matter has decreased by 55% since 2005 and nitrogen dioxide by 50%. And finally, the example of Brussels and Antwerp in Belgium. Pollution from nitrogen dioxide has decreased by at least 30% over 5 years in the low emission zones of the cities of Brussels and Antwerp. The study examined the effects of low emission zones introduced in Antwerp in 2017 and Brussels in 2018. These are the first 2 Belgian cities that have implemented this measure. The impact extends beyond the low emission zones themselves. The improvement in air quality was observed up to 5 kilometers away. Researchers also note that air pollution in Brussels has declined the most in the city's most disadvantaged neighborhoods. I have mentioned fine particulate matter. Let's have a look at the situation regarding fine particulate matter in Europe. As you can see, the differences between the regions are huge, but you will also understand that in many regions in Europe, children suffer from the consequences of the large concentrations of fine particulate matter. Then wood burning. Wood burning produces 23% of the total fine particulate matter generated within the Netherlands. 23%. Research shows that measures against wood burning are the most effective way to reduce fine particulate matter. This is research in the Netherlands. If the government truly wants to improve air quality to protect the health of citizens, limiting wood burning is a necessary and logical step. And how to reach this less wood burning? Well, there are a few possibilities. First of all, increasing the public awareness about the health risks of wood burning, for example, through an information campaign. Also by creating wood burning free neighborhoods, for instance, by prohibiting the installation of chimneys in new housing developments. Also encouraging residents to remove their chimneys from their homes, for example, through subsidies. In the Netherlands, several municipalities have introduced a ban on wood burning during times when there is little to no wind. The next one is the air pollution coming from livestock farming. Agriculture also contributes to air pollution. This is due to secondary fine particulate matter formed from ammonia emissions and to primary fine particulate matter. Primary fine particulate matter mainly originates from poultry farming. Ammonia emissions primarily come from animal housing and fertilization. I will again name a few effective measures. First of all, adoption of the Dutch Public Health Service advice to maintain a minimum distance between livestock farms and sensitive locations, such as schools, childcare centers, healthcare institutions, and homes. In the Netherlands, this minimum distance is 250 meters. Specifically for poultry and goat farms, the recommended distance is 500 meters and 2 kilometers respectively, which means 500 meters for poultry and goat farms 2 kilometers. Unfortunately, it is only a recommendation, so you probably understand the disappointing results. Making health a central factor in permitting process for livestock farms. For example, by introducing a health impact assessment alongside the already existing environmental impact assessment. This is actually following the WHO 2021 air quality guidelines. And also independent monitoring of emissions from livestock farms and enforce regulations actively. Finally, research shows that a livestock emission tax would be one of the most effective measures to reduce ammonia, which causes much secondary fine particulate matter all over the country. And finally, measures in relation to the air pollution coming from industry. To reduce air pollution by industry, similar measures can be taken as those applied to livestock farming. Clearly, integrates public health objectives into the permitting process, for example, through a health impact assessment, like with livestock farming. Ensure proper monitoring of companies and enforce compliance in case of violations. The environmental agencies must be given sufficient capacity and resources for this. And also here, keeping sensitive locations, such as schools, childcare centers, healthcare institutions, and homes, at a safe distance from polluting industry. And finally, also here, like with livestock, money works. Research shows that the Pigouvian tax for nitrogen oxide would be one of the most effective measures to reduce fine particulate matter. The Pigouvian tax is a direct levy on harmful emissions produced by companies. Finally, I would like to say something about the choice of words. The invitation for this webinar said, "See you at the next webinar on 19th of June, Clean Air Day." Of course, the organizers did not invent the whole idea of Clean Air Day. But in many European countries, there is a change in the political climate. And in this political climate, words matter. In the Netherlands, we have noticed that it really helps when we talk about healthy air and not about clean air. Of course, it means the same thing, but clean air is immediately associated with climate activists while right-wing political parties also consider health important. So my suggestion to you is this for consideration. So maybe the next invitation will be see you at our next webinar on Healthy Air Day. Thank you for your attention.
Thank you, Károly. Are there any questions? I remember to write them in the question answer box. But right now I don't see any question, so maybe later they will have. Okay. So thank you, Károly, for your wonderful presentation. I would move on the other presentations and then maybe come back if there are any question. Okay. So the second presentation is a two-speaker session. Our presenters are Dr. Helena Clements and Felice Stevenson from the UK. Dr. Helena Clements is a pediatrician, associate medical director, and climate action clinical lead at the Sherwood Forest Hospital's NHS Foundation Trust. She chairs the clinically advisory group for the Nottinghamshire Greener ICS board and collaborates with the Midlands Clinical Senate and the Royal College of Paediatrics and Child Health, where in 2023, she was appointed as the first officer of the climate change. And we have also Felice Stevenson, that is a climate change manager at the Royal College of Paediatrics and Child Health, where she leads a team of clinicians and policy professionals working on sustainability and clean with a background in health research and evidence-based policy development. She works closely with clinicians, researchers, and stakeholders to ensure that children's health priorities are informed by high-quality data and analysis. So, thank you, and you can share your presentation.
Thank you for that introduction, Lorenza, and also Károly for your great start for this evening. And I love the suggestion that we call it healthy air rather than clean air. I think that's very wise and something that we should adopt. So as you just heard, I'm the RCPCH Officer for Climate Change, and I work alongside Fliss. And we've been working on clean air with the Clean Air Fund, and we've had some trainee paediatricians working on this over the last couple of years. And this week and next week is really the culmination of 2 years' work with the Clean Air Fund around air pollution. And I'm not referring to any children, but in England, we also have children who we can name as really significant people who have really driven paediatricians to stand up and act for clean air. So I'm going to follow on from Károly's talk around how we're demanding change and being advocates in this space in England, and the cost of air pollution. So a little bit more from alongside what Károly said. So next slide, please, Fliss. So as Károly just referred to, the scale of the issue is enormous. We know that indoor and air pollution has provides a healthcare burden, which is estimated at a cost of about $6 trillion per year across the globe. So an enormous cost to dealing with air pollution. And we know, as we heard from Károly as well, that children are becoming sicker. Their life expectancy has stopped increasing because of air pollution, among other things. And our healthcare services are hugely strained. Care responsibilities are also an enormous part of that economic burden. So we know that as children and adults are sick because of air pollution, that the productivity is reduced. If parents are looking after kids at home because they're sick, they're not at work. And we see that within our health services as well. 1.2 billion work days are lost globally. So these are hard numbers, and pound notes or dollars or euros that we can use to speak to our politicians and policymakers. So, and finally, I think that thing that's really important to recognise is that those contributing least to air pollution are often suffering the harshest consequence. And that's true globally. But it's also very much true when we have health inequalities in our own countries. And again, Károly mentioned that when we make improvements. Next slide, please. So if we act on air pollution, what's the payoff? So studies in the UK have suggested that by achieving air quality guidelines set by the WHO, which are not the same as the ones that we have legally at the moment in the UK, we could boost the economy by £1.6 billion. And that's an enormous amount of money that we can save by addressing air pollution. So there has been some research done since the ULEZ, the ultra low emission zone, which has reduced air pollution in London, with significant reduction in emissions of nitrogen dioxide, PM 2.5, 31% lower if the ULEZ had not been expanded. And the air quality has improved at 99% of monitoring sites across London since 2001. So we're getting data now to show that this is really helping. And as we act on air pollution, there's a reduction in long-term health problems. We can reduce respiratory issues like asthma or bronchitis. We can expect to reduce hospital admissions for respiratory conditions such as COPD, and avoiding admissions to hospitals, which is really important. And we've shown that within the ULEZ work, 2.8 acute respiratory admissions per 10,000 people in London. We can reduce the number of prescriptions, which of course has an enormous carbon footprint and cost, and reduce sick leave. And that's very significant in terms of the productivity right across our health services and all other industries and workplaces as well. So overall, that we believe that there's been a cost saving of £963 million in Greater London since that was initiated. Okay, so next slide, I think, is where Fliss is going to talk a little bit about how we, as the Royal College of Paediatrics and Child Health, are working with the Clean Air Fund to address this as well. So over to Fliss.
Thanks so much, Helena. As you and Károly have said, these are huge numbers that we're seeing that can make a real difference by doing more action on air pollution. And often it feels like this huge problem. So what we've been trying to do at the Royal College of Paediatrics and Child Health is break that down and see how we can actually help healthcare professionals to feel like they can both have the education that they need to be able to support their patients and families, and the education they need to be able to advocate in this space. So you can see a QR code there on the screen. That's a link to our air pollution companion, which I'm going to talk a bit more about on the next page, which we've been able to produce as a result of, as Helena mentioned, this whole program of work we've been developing over the last 2 years as a result of funding from the Clean Air Fund. So if you go to the Air Pollution Companion, what you'll see on the homepage is all these different areas. So we have a knowledge hub that's for clinicians to have resources. We've filmed simulated videos. So at a hospital in London, we've had a number of different healthcare professionals talking to patients about air pollution, showing how you can bring this kind of conversation into a routine conversation. So, you know, when you're seeing a patient about any number of different reasons, what sort of questions you could be asking and what kind of routine advice you could be giving. So there's a bit of background as well about air pollution in general and what it is, because I think there's As Károly also said, there can be confusion around some of these terms, and people, they might understand what climate change is, but they might not necessarily know what clean air is, or vice versa. So just a real breakdown of some background knowledge. There's also an advocacy toolkit, which I'll talk a bit more about with you guys today, breaking down to paediatricians actually about how important their trusted voice is in terms of getting this message across. So, being part, as the Royal College of Paediatrics and Child Health, we sit on a lot of wider boards and wider coalitions about clean air advocacy. And what we've really seen is the impact of being able to communicate those health impacts and how much more politicians do, and your average everyday person, that really hits home in comparison to when you just talk about the environment alone. So we've got some case studies on there as well about people doing amazing work across the country and internationally in this space. Our clean air community. So we have a clean air network, which is healthcare professionals wider than just paediatricians who really are active in this space and want to do activism and are already doing things locally to improve services and support the education as well as the uptake of policy on clean air. And as well as we've got some information. So in the UK, we actually have 2 specialist clinics based in London and Liverpool who work primarily as a multidisciplinary team to support families specifically on respiratory issues linked to clean air. And then whilst they're supporting with those issues, they will also be advocating for them across the housing sector, and giving the family resources to be able to, where possible, improve their conditions and learn a bit more about the impacts of these. So this brings me on nicely to our report, which Helena mentioned that we're launching next week. This is an exploration of the pressures that are being put on clinicians, so specifically across the UK, and how the impact of indoor air pollution, inadequate housing, as well as outdoor pollution and overcrowded living, how these are affecting specifically communities across the UK. But we have a specific lens on London and Liverpool because we've interviewed clinicians working at these specialist clinics. The report shares why the clinics were set up, the important work that they do, but also some really stark case studies about the impact that this poor air quality is having on families and children. For some families, the damp has been so bad within their house and the conditions have been so bad. You've had families living in whole rooms. You've had, people I think one of the families was for maybe 7 years, hadn't been able to get anywhere, knowing that the mold in their house was making their child's asthma worse, appealing to the housing association. Then only with the support of the clinicians working at the clean air clinics were they able to properly, be listened to by the housing provider to be able to get moved. And obviously, for clinicians, knowing that these environments are really impacting their patients, they often can feel like, we just put a plaster over the problem, when really what we need is governments, local authorities, which is what we call our local government administrations in the UK, to be able to be doing more and actually adhering to the legal guidelines around this. So this report really highlights those cases, but also has some really clear messages to government. And it builds on a piece of work that's on screen now, which is our air pollution position statement. So this is a statement which we give to the paediatricians that we work with, which is our main cause specifically in the UK across each different sector. That it's because that clean air network that I mentioned, quite a few people have had opportunities to speak to politicians on both a local and national level, and it's a one-stop piece for them to be able to see, right, these are the points that I clearly need to get in front of them. And you'll see, so across the most importantly for us, getting that Clean Air Act and getting this all legally binding, but we've got things across our NHS services, schools, transport, housing and wood burning. So similar to what you'll be seeing in the report when that's launched next week, these are how we're really putting pressure on the government, because although it's great that we, clinicians seeing the impact they can have and the advocacy work that they should do, our services are already strained, clinicians are already strained, and we need the government to step up and do more to legislate to make sure families are living in better environments in the first place. So we also have, on that note, this is on the Air Pollution Companion 2, a media guide. So I won't go into detail, but it's, telling paediatricians, we speak about it at the Clean Air Network, but also if you were just visiting the website, some top tips from our media team about how to get this message across, like how you can be formulating your argument, how you can emphasize your point, and to make that as effective as possible. The clinicians Helena mentioned within the team that we work in have had opportunities to speak on our national news outlets and things like that, and working with them, these have been really useful tools to be able to really hit home to get those messages across. So that brings us on to, I was going to bring Helena back in here now, because she is such a huge advocate and member of our Clean Air Network and community, to talk a bit more about this and the ride for their lives as well.
Thanks, Fliss. So yes, I think what we're trying to demonstrate here is how to engage paediatricians in advocacy. So rather than a few of us making it possible for many. And the picture on the left is the paediatricians at our annual conference, including our president, who's there in the middle, who rode around Glasgow, where we had our conference, to demonstrate the ethos of Ride for Their Lives, which is a cycling network promoting clean air and fighting against air pollution. And the map on the right is a route that has happened today in London, where a whole bunch of colleagues, paediatricians, clean air advocates have walked or cycled from Great Ormond Street Hospital to Westminster to deliver a letter to government about air pollution with our demands. So many of us have signed the letter, and that has been delivered to Keir Starmer and the Secretary of State for Health. So those have been happening today, and in fact, today around the country we've also been doing a synchronized cycle to work and getting paediatricians to stand up outside their hospitals and say, this is Clean Air Day, and clean air matters to us as children. And that's that I've been seeing photographs have been coming in from all around the country, which is really encouraging. So really trying to get people to feel able to be active and be advocates for children and for clean air. Next slide, please. And that's been a very much a theme from us in the Royal College. So as you saw, we have our own position statement on climate change, but Fliss and I have also been joined with the European Paediatric Society to develop that position statement. And contributing to policy locally, I think, is also something that we've been very strong on. We've had a parliamentary roundtable events on indoor air quality with the building industry, so that's quite exciting. That's coming up. And a couple of weeks ago, we were with MedAct, which is a charity acting on health, about homes for health for people who are living in very poor quality housing. The Royal College of Physicians have launched a clean air paper today as well, and we work very closely with the other Royal Colleges across the UK in UK HAC, which is the UK Health Alliance for Climate Change, trying to really join forces to take this health message about air pollution and climate change to government and to the public, just as Károly was talking about as well. So there's an intercollegiate sustainability group and organisations like Ride for Their Lives, which is by paediatricians but slightly separate from the college, and then other coalitions with Clean Air Fund, Healthy Air Coalition and Global Action Plan. So very much what we've been doing in these last couple of years, and particularly today. I wanted to use this phrase, paediatrics is not fluffy, and I appreciate you're all listening in a different language. I think we often are associated with being sort of gentle doctors who look after children and have a little teddy somewhere and all of that fluffiness, but it absolutely isn't. And these are some quotes that I've taken from the work that we're doing for the European statement, the Pan-European statement. So the first one is about parental carers leave in the work impacts on productivity in every sense and has direct costs through covering gaps and expensive overtime. So we absolutely seeing this in the NHS. Particularly because our workforce in the NHS is disproportionately female. So if they're caregivers, the sick kids affected by climate change or by air pollution impacts our workplace. On an economic perspective, it's in the interest of every industry for children to be healthy, and addressing the avoidable harms such as air pollution will allow paediatricians to deliver healthy young adults to the health services in the workplace. And I think this is a really important message that I try to give to the other colleges. We're much smaller than the adult physicians, for example, and yet they really need us to give them healthy young adults. And I think that's an important bit. And when we think about clean air and giving access up to green spaces to children, opportunities to exercise and to take part in active travel, that has such a potential in improving health, both physical and mental health, which if we fail to address, just delivers unhealthy adults into the with poor economic potential, which is very costly to health and social care as well. So I think we need to make the economic we need to put that forward to governments and to the populations and make this a health issue, but also an economic issue. And I think that's a real strength that we as paediatricians across Europe can join together with. Thank you for this. So I do believe that our collective voice can be very powerful. Our adult health colleagues need us. And everyone cares about their own health. And this goes back to Károly's point about making this about healthy air rather than just clean air. So I think making it a health issue is wise and something that we should absolutely do. And to do that, we need to be at as many policy meetings as we can be, and not just health meetings. We have to be there at the table when people are talking about building policy, transport policy, industry policy, again, as Károly said. And I think there's a really strong economic case and we should use it. This is a photograph taken of a parliamentary roundtable with one of my our paediatric fellows, putting the case of child health to that very senior team. So that's me done. There's some reference slides at the end, which I'm sure can be shared, but thank you for listening. And I'll hand back to Lorenza. Thanks, Liz.
Thank you, Liz and Helena. And this is a powerful example of how medicine and local policy can and must work together to provide concrete solutions. I want to come back to the previous presentation because we actually have a question to Károly from Georgi, Kvina-Shvili, sorry for the pronunciation. And the question is, I would like to know if there is any evidence, for example, article or research that early exposure to air pollution in children could increase the risk of developing neurodegenerative diseases in adulthood. And if so, could you explain mechanisms by how it affects central nervous system? Thank you.
Well, I already said in my presentation that we do not know the mechanism. So to answer the last question, we do not know that. But indeed, there is evidence. And what I shall do is I will send it to the organizers so that the organizers can send the evidence, the scientific material to all the people who are now participating.
Perfect. Thank you, Károly. So let's move on to the last but not the least presentation from Dr. Laura Reali. She's an Italian primary care pediatrician, and she's the president of ACPCP, contract professor of pediatric primary care in Rome, and She is a member of the environmental working group of ACP, of CEP, of ACPCP, of EAP, and of IPA. And she is particularly dealing with integrating environmental health into pediatric care and climate change issues. Thank you, Laura.
Sorry, the button of my audio didn't work. Sorry so much. Thank you for your kind presentation, Lorenza, and thank you to all my previous presenters because they have been great presentation, really, really interesting. My presentation will be a very little one about the primary care perspective because I think that this is a very important perspective because we must work together. As Ellen and Károly said very pleasantly, it's awful to think to do something alone in this issue. We will have to work together. So I will try to speak something about strategies to mitigate the negative effects of air pollution on children's health from a primary care perspective. We can begin from this point. As pediatrician...
Sorry, we cannot see your slides representation.
Oh, sorry. Maybe I did a mistake in the sharing of presentation. Do you see now?
Yes.
Okay. Sorry, it was my mistake, obviously. Well, we are speaking about strategies to mitigate negative effects of air pollution on children's health, and we are speaking about what we can do as pediatricians, because firstly, we are a trusted source of guidance for families, and we advocate for community and clinical setting child health. Then we have the opportunity to identify and manage environmental risk. But we have to remember this, what we should do so. In primary care strategies designed to protect the health of children should prioritize education, risk assessment, and targeted interventions. For example, integrating environmental health promotion into standard care, recognizing and reducing environmental hazards, and encouraging healthy behaviors. The primary areas of focus should include the effect of air, but also water quality and food safety. And as far as climate change, plastic pollution, lead exposure, one time that we are speaking about environment, we have to speak about everything tailored on local situation. In fact, there is a growing amount of evidence about the fact that air quality and environmental pollution and climate change are acting all together, and air pollution and climate change are closely interconnected and in some cases synergistic. As for example, extreme temperature increase plus air pollution worsening and growing asthma attacks incidence. This could be an example, as already Károly said. So this is the reason why we have to remember to act on the environmental issues when we are in our daily practice, for example, where we are well poised to reduce harms to our patients and to promote health equity in responding not only to climate crisis, that is the a well-studied issue, but also to the air quality. And in this paper, this was one of the first where there was a pediatrician's guide to climate change informed primary care. Then there was similar suggestions about every kind of environmental issues, included, of course, air quality, because we have the opportunity in the well baby check visits of doing our job at the best. For example, we have the opportunity to presenting screening protocols, including structural determinants of health and climate risk. We can make health promotion, including health and planetary benefits, OPS, and we care of all children with complex medical conditions, displaced children with asthma and allergy, or particularly sensible to pollen and air quality worsening. And the anticipatory guidance are informed not only by climate change, but every kind of environmental issues, included air quality, because this is our job and we have to act all over these issues. Lastly, we have to share and to spread referral plans about environmental issues, like Elena shows before. Which are the core strategies of the environmental health in our well baby check visits? Education and awareness, for example, about information, school-based environmental health education, healthy behaviors, but also risk assessment and management. The environmental history is one of the most important points in some situation where the asthma incidence, for example, is not clear, or the asthma therapy, just to remember the Károly example, is not going on well. Environmental history can explain us if at home or in the school environment there are situations, or in the air quality outside, there are problematic that are able to explain why that asthma is not going well. And so this is another point to identify the hazard, to make referrals, and then we can have the possibility to make some targeted interventions about climate resilience, air quality education, and reducing exposure when children can go out, or when they is better that they remain at home, about the ozone, photolytic ozone amount in the air, or about the particulate matter concentration in the air, and what about water safety, and so on, chemical safety, food safety, and at last, advocacy and capacity building with politicians and with research, for example. Training for providers on pediatric environmental health is last but not least important point, because training is important to involve much more people in this job. Collaboration with educators, communities, and public health is also useful, because we have to work with all the people, all the stakeholders involved in this matter in a coherent, consistent way. The guidance, the anticipatory guidance that normally we can give during these well baby check visits must be tailored, because of course one size does not fit for all. And what is happening, for example, in the north of Italy, so polluted from a very, very bad air quality, is very different from what is happening in the south part of of Italy, that is my country. So this is the reason why I'm doing the example, where the heat waves and problem with the scarce amount of water are the most important environmental issues. And they are in the same country. Therefore, how to protect children from air problems? This is a very nice list of suggestions done by UNICEF and WHO. For example, we can monitor the air quality about the information from AQI index or many others that are available. We have to try to reduce the time spent in areas where pollution is high, but we must know where this is. And so it's important to have such kind of information. And when air pollution is particularly bad, we have to suggest to the families what is correct to do, because sometimes indoor the quality air is not so better than outside. And when air pollution outside is extreme, for example, such as during wildfire, we have to give the right suggestion to the people to remain at home and what to do at home, indoors. Indoors, in this list, the suggestions are many more, because indoor sometimes the situation is worsening, because the outdoor pollutants are adding to the indoor pollutants, and the result is that the situation is not so good. We can suggest to check every room of the house to verify the situation and the quality of the air indoors too. This is only one of the lists that we have, and I have shown it because it's done by WHO and UNICEF, so it's very, very simple to find, but this is not the only one. In this matter, I can say that the issues, the papers, the informations available are too many. We should find a way to select the best of them. And at last, when we have the opportunity to speak with the parents and they ask us, what can I do with my child? These suggestions are very simple and linear to say, but we can say to consider daily actions like cycling, walking, preferring green spaces. There is a great amount of papers about the possibility to improve not only the general health of the children, but also the mental health, also of children with mental issues like autism, ADHD, and so on. So it's very important to have this kind of green spaces available. And it's important to have a zone far from high traffic and to have the possibility to read a book in a calm, green, pleasant, and relaxing place, possibly with your parents or with your families. There are a lot of simple suggestions that we already well know, but we have to remember them, to spread them, and to remember also that they are not only useful to arrive to have a good quality of air, but only to have a good wellness and way of being healthy with all the family. Another environment very important to remember is the school environment, where children spend most of their time after home and daycare. And the transportation is a problem too, but the concentration of air pollution in these areas, in the school and daycares mostly, are strongly influenced by the proximity to nearby roads, traffic density, and traffic flow. So we should reduce air pollution around school. It's imperative, and others can significantly decrease daily exposure, because if the children spend from 6 to 8 hours at school, it's important that the kind of air there should be clean. So we should implement clean air zone around the school, placing new school away from pollution sources, and designing school with green spaces that can help minimize exposure. And additionally, minimizing exposure while on site is crucial for healthy environment. Last but not least, a call to action. Adolescent health and well-being is in danger, and the Second Lancet Commission has already published a very important review of the situation. By 2030, half of the adolescents will live with multiple health burdens, but only 2.5% received global health aid for this, and the most part of those health burdens are for mental health and for environmental issues. So the Commission proposes multi-sectoral actions very well explained that we should know to spread to the adolescent and their parents to improve their quality of health. And I just conclude with this paper because, sorry, it's in Italian, but the most important thing is that improving child and adolescent health and well-being in Europe is the imperative for a new regional strategy in Europe. We have to worry, but not only worry, we have to act to protect the child and adolescent health, especially for environmental issues. This is a simple reminder for doctors. Pediatric healthcare practitioner can do this: digital clinical records, comprehensive screening for environmental exposure, anticipatory guidance, and pediatric health bodies can make environmental health literacy campaign, environmental advocacy, and research. All of those are important to reduce our carbon dioxide footprint on this planet and to obtain environmental sustainable pediatric care. So remember, please, WHO air quality strategy is simple to apply. Remember that air pollution is a preventable health risk, and we should do all together all the WHO air quality strategy recommends to obtain this, to achieve this objective. And primary care can educate, manage, and advocate on this issue. Thank you.
Thank you, Laura. I don't see here any question, but actually I have one question for all of you four, and it's if you could say a few words about how air pollution affects the fetus and whether there are any public health policies in place to address this issue.
Well, we can answer beginning from the first presenter, following the list.
Yeah, I told some things about scientific evidence. My proposition to you, Lorenza, is that I will send to you or to Lorraine the relevant articles about my presentation.
Thank you.
And that you take care of distributing it to all the participants. Is that okay? Yeah. And actually, I have another meeting now, so I will leave you.
No problem. Thank you very much for your precious presentation.
Thank you. Bye-bye.
Thank you, Károly. Elena?
So yeah, just very briefly, I mean, we know that the PM2.5 particles can cross the placenta and enter the fetal all of the fetal organs, so they're there right from the beginning. But they also, you know, air pollution increases the risk of low birth weight, premature delivery, and so adverse outcomes of pregnancy as a result of that. So there's quite a lot of different things in there, but those particles are already entering the fetus through the placenta, as well as having those negative impacts. So I think we know enough to know that we need to do something about it. And joining forces with the RCOG, our Royal College of Obstetricians and Gynecologists, is something that we're very keen to do because of that, because we have a vested interest in the outcomes of those pregnancies. So really important stuff. Don't know whether Laura wants to add anything else.
Oh, only a few words, because you have already clearly exposed the most important thing. But it's important. I didn't speak about this in my presentation because the time was very short, but we know, as Hélène said, all the harms and damages that air pollution give to the mothers, because the particulate matter arrives from the blood, from the lung of the mother, through the blood of the mother till the placenta and the fetus, and particulate matter is damaging brain, kidney, heart of the fetus. So especially lung and brain at the birth, it's already damaged. And if the child remain in that kind of situation of a location and air quality, obviously it will only worsen. As pediatrician, often we arrive late because this is a matter for gynecologists. But in any case, we catch the opportunity during the well baby check visit from the beginning, and at the second child sometimes, to remember to the mother, please avoid second-hand smoke and first-hand smoke at home, and third also, and avoid place outdoors with bad quality air. We have a lot of suggestion about this and anticipatory guidance, but in my experience, this is my opinion, but literature is clear, evident, we should work together, because if there is not consistent information, the woman arrive late, and sometimes the economic burn of this late arrival is very, very important.
Thank you, Laura, and thank you all of you. I think we have no other questions, and I would say, so thank you for all the participants and for your precious presentation. And I want to invite you for the next webinar about choosing wisely, and you find the message on the chat. And so have a good evening to all of you, and bye.
Goodbye. Thank you. Thank you.
Bye. Thanks, everyone. Good evening. Bye.
Good evening.
That's actually just what for the call.